Good morning. My name is Emily, and I am an occupational therapy student at the University of St. Augustine. And today I will be addressing the IADL of medication management for a client suffering from alcohol withdrawal. This type of withdrawal peaks typically within the first week of cessation of alcohol. Symptoms can be very physiologically and emotionally painful. And it's important, though long-term effects aren't as prevalent with this type of withdrawal, it is important to be aggressive with medication management, particularly at the very early or acute stages of alcohol withdrawal, to prevent long-term physiological and psychological effects, and most importantly, to prevent relapse of ingesting alcohol. Today, I will be discussing the specific medications prescribed by the client's primary care physician to manage the symptoms of alcohol withdrawal. I will be discussing their precautions, side effects, and then I will be addressing an occupational therapy intervention plan to help manage the medications for alcohol withdrawal. Precautions for these medications include do not take the following medications with alcohol. We also want to be cautious while operating heavy machinery or driving vehicles while during the time period of ingesting these medications. They tend to have a very they have a very significant effect on our our motor planning systems. So you tend to be less alert, have slower reaction times to stimuli, and we also want to make sure that these medications are not ingested by children. So do not take medication with alcohol. Be cautious while operating a vehicle, as the side effects tend to inhibit or make driving or operating heavy machinery difficult due to slow or delayed reaction responses, and these medications are not intended for children. First, I will be addressing Valium, which is a benzodiazepine that is typically used to treat depression and severe anxiety. With alcohol withdrawal, anxiety is a very largely affecting, inhibiting factor while withdrawing from alcohol. We want to make sure that we are aware of common side effects of this type of drug. Valium typically can promote hypotonia, so low tone, so your muscles tend to be a little more relaxed and flaccid and not as quick to respond, reflexes not as quick. Shakiness tends to be apparent, and also an unsteady gait. So when walking or ambulating from room to room or from place to place, you may feel weak, you may feel unsteady, unbalanced, perhaps shaky. So it's important to be mindful of this and to take our time when transferring from room to room or position to position, as Valium tends to affect our motor control and coordination and make us slower and more unstable. Next, we have a beta blocker, Tendermin specifically, which will address the autonomic symptoms that typically occur with alcohol withdrawal. This type of beta blocker will help to curb an increased heart rate and or elevated blood pressure as a result from alcohol withdrawal. And side effects include impaired cognition and potential slowed reaction times. So again, when operating vehicles, when doing daily routines, tasks, especially ones where safety might be an issue, such as cooking over a hot stove, operating heavy machinery, going up and down the stairs with a pile of laundry. Just be cautious that your thinking processes and or reactions to your outside environment may be impaired or slowed. So just to be cautious of this. And finally, to treat the high blood pressure of the assigned client, microzide, which is again, a water pill and a medication to treat high blood pressure, kind of similarly used and has the similar effects as the beta blocker that was previously discussed. However, this medication may promote pain more so, blurred vision, numbness and paresthesias in your arms or legs. So again, be conscientious of these side effects of this high blood pressure medication, microzide. Your vision may become impaired, numbness, paresthesias, and or pain, which could inhibit mobility, could cause some psychological effects, could promote depression. So it's important to be conscientious of these side effects. Okay, now that we've discussed the medications, general important precautions, and the side effects of the 3 medications for the purpose of this assignment, I'm going to address an occupational therapy intervention plan. A little background information. Client is 45-year-old female with a diagnosis of alcohol withdrawal and also high blood pressure. So we discussed the medications that would be used in order to treat the anxiety and the autonomic effects of withdrawal, and also her high blood pressure. OT intervention plan would include to make daily alarms on a phone. Client is a mother of 2 and she works and has a husband. She lives though she is experiencing this diagnosis, she has to continue life. She has to continue to go to work as she perhaps may lose her job. She has 2 children that are in school. She's responsible for carpool, for bills, for home management. She has a husband. So it's important that we facilitate her normal daily tasks and continue to make her facilitate her function as much as possible during this time period, though she will be mentally and physically feeling the effects of alcohol withdrawal. So again, to address habits, make a daily alarm on a phone as a reminder to take medicine. Client always has her phone on her, and she, again, is a working mother of 2 and often forgets general things, and now suffering from alcohol withdrawal, this working memory is even more so impaired. And so it's important to have phone reminders to take her 3 medications multiple times per day as prescribed by the doctor in order to help give her reminders via her phone. Again, always having her phone on her, and these are auditory reminders. Routines. To address routines, we could incorporate a medication management schedule during the time period of withdrawal. Again, client is very busy. She leads a very busy lifestyle and is a working mother of 2, and as a result forgets general things, but again, now suffering from an additional withdrawal could it potentially impair her working memory. A visual schedule is a great way to document and visually have a routine of when to take each medication in the morning, in the afternoon, and in the PM, at what time, how much. The dosage would be important so we do not take too much or too little. So a visual schedule is a great way to write out the dosages and the times of day and how much medication needs to be taken every day. Perhaps client can cross off every time she takes her meds so she can see when the meds have been taken for that day or during that time period, whether it be morning, afternoon, and or in the evening. Also, I'm suggesting a pill box. This is an example of a color-coded pill box that has morning, noon, and evening slots for medications. Obviously, client will have to be conscientious of staying organized with this weekly. However, this is a great tool to use to stay organized, to see what pills have been taken, when they've been taken, and used in conjunction with a visual schedule. These two visual tools I recommend for this particular client to facilitate any memory recall that may be impaired during this withdrawal time period, and to also help with task sequencing as her working memory and perhaps even her cognition may be impaired during this withdrawal period while continuing her functional daily tasks. Rituals, client. I'm suggesting to encourage the client to set time aside every evening at a specific time to self-reflect by taking time to read from her daily devotional for women. This will facilitate proper coping techniques and will promote a better, more clear state of mind during this time period of withdrawal. I'm also providing information on and encouraging patient to participate with a local support group for mothers recovering from alcoholism, and particularly mothers that have experienced and or are experiencing alcohol withdrawal. This would potentially facilitate also more positive coping skills, would also allow for a client to be socially interactive with other people alike, perhaps going through the same experiences or similar. And again, this could facilitate more appropriate coping mechanisms in addition to the medication. And again, in the context of this particular client situation, client is a 45-year-old middle-class woman with a job and a family and must continue her day-to-day functional daily tasks. However, with the withdrawal symptoms, these are most likely going to be impaired. However, with proper medication management, with patient education of precautions and or side effects, as we have previously suggested or mentioned, and a strict aggressive schedule, including visual schedules, pill boxes for task sequencing and memory recall, for the management of alcohol withdrawal. Thank you.